Uno. Listos.
Hello, my name is ADELAIDE NÚñez. I'm an internal medicine resident from the Antiguo Hospital Civil de Guadalajara, Fray Antonio Alcalde, and he's my colleague, Dr. AXEL Rodríguez.
Hi, Adelaide folks. My name is Axel Rodriguez. I am an internal medicine resident from the Hospital Civil de Guadalajara too. Today, we have the honor to present you the following case. This is a clinical case presentation named Corpus Callosum Agenesis as an incidental finding in a patient with clinically isolated syndrome.
The reason we were so interested in showing you this case is the simultaneously rare presentation of two neurological entities. Firstly, the out of common appearance of corpus callosum abnormalities with a reported frequency lesser than 1% population, broadly manifested with neurocognitive impairment and mostly presented in early stages of age.
In this case, we discovered this entity in an adult stage just for the clinical demonstration of a demyelinating disorder. Let us introduce you in this clinical situation.
A 17-year-old man presented to an outpatient clinic with weakness and inability to walk. As chief compliant, he denied past diseases, use of any medications, alcohol, or high illicit drugs. And at the clinical examination, he had upper motor neuron syndrome with hyperreflexia of both pelvic limbs, and the weakness was symmetrical and with distal predominance. He had no signs of cerebellar affection, nor visual loss or tactile disturbances.
A MRI was made and showed a complete absence of corpus callosum, represented in Figure 1 and Figure 2. The racing car sign, a classical radiological sign of this entity, is depicted in Figure 3. Also showed in the Figure 4, posterior zones of C3, C4, C5, and C7, and close to the medullary cone were hyperintense lesions compatible with myelitis. The visual evocative potentials were compatible with the demyelinating disease because of the clinical suspicion of neuromyelitis optic spectrum disease. In this case, anticoparin 4 antibodies were required in cerebrospinal fluid, which were negative. But given the diagnosis of longitudinally extended myelitis, it was decided to initiate treatment with methylprednisolone for 5 days. This clinical problem introduces a few queries. First, are these two conditions in fact associated or just two isolated events? Then, if the two conditions are associated, the next question is a corpus callosum agenesis a predisposing factor?
In order to answer these questions, we performed a deep research and found that there are multiple conditions that coexist with presentation of multiple sclerosis. Frequently, comorbidities associated with multiple sclerosis are autoimmune disease, psychiatric conditions, neoplastic disorders, or even vitamin deficiencies, more specifically vitamin D deficiency. But the associations or susceptibility to develop multiple sclerosis in congenital neurological abnormalities is poorly considered. We found only a few case reports in the literature and a similar clinical case in recent publications. Therefore, this case could contribute to further investigations about the connection between demyelinating diseases and congenital neurological abnormalities. Thank you so much for your time and your attention, and have a great day.
Thank you.